Welcome back to the implementation track, our final session. I am your host for the track all weekend long, Dr. Damon Durker. I am broadcasting live from my office at Eye Surgeons of Indiana in Indianapolis. This is going to be a lot of fun, very interactive last session. I've got Dr. Laura Periman and Dr. Sathi Maiti coming to us from the Periman Eye Institute with Dry Eye on a Dime. Dr. Periman, Dr. Maiti, welcome back to Eyes on Dry Eye. I know you were over on the clinical track, the scientific, kind of the highbrow track. This track is the, hey, let's tell it like it is. And what is the motivation behind your topic today, Dry Eye on a Dime?
Well, it's, as clinicians who treat dry eye disease, it's common, and I would love to hear if our colleagues have the same experience, but it's common for patients to get frustrated that just one drop that you've prescribed isn't working or isn't doing the job. Like, I really do expect these things to work with regular use, but I call this the Big Mac phenomenon. You can't take a pill for your diabetes and high cholesterol if you're still doing big gulps and Big Macs every day. And that's the inspiration for this. The other inspiration is that some people are strapped for resources, and there's a myriad of simple, everyday, easy to implement practices, lifestyle practices that your patient can do to help themselves. So that's the inspiration of today, is like this overall concept of wellness and that serious dry eye patient who's like, I'm all in, just tell me what I got to do. This is created for you.
Dr. Maiti, any comments on that?
Yeah, I mean, I think it's one of those things where, we've been listening to all these awesome dry eye talks all weekend. But one thing that really comes up a lot is a lot of our treatments are really expensive. The costs add up to patients. And like Dr. Periman was saying, we need to take care of the whole body as well, or all these things we're prescribing, all these, procedures we're doing are not going to be as effective as they can be. And these are sort of also good starting points for patients. One thing I always say to patients all the time is, remember, your eyes are part of your body, and everything you're doing to take care of the general health of your body is going to impact the health of your eyes as well. And so that's a really important factor. So today's talk, we're going to focus the first part on these 5 pillars of wellness. So hydration, nutrition, sleep, exercise, and mindfulness. First one, we'll start out with hydration. I think this is pretty obvious to most of us, that we need to hydrate our bodies, and that's going to impact dry eye. And there's actually been a study I had come across where they actually tested blood plasma osmolarity in patients with dry eye, and found that it was higher than in people without dry eye. And to where some researchers were even considering, could we use tear osmolarity as a proxy to test for blood plasma, as a way to test for dehydration? Like, that's how closely the two are correlated with each other. So, I think this is a pretty easy suggestion to make to patients, to increase their hydration, to try to cut down on things like caffeine and alcohol, things that will further dehydrate them.
Yes.
Any other tips? Yeah.
Yeah. What's interesting about this? Like, I was super skeptic. Like, I'm science-driven girl, and I'm like, yeah, they say hydration, but really, is that really going to impact dry eye osmolarity? And then I went to Arvo. This is about, 2013 or something. And there was this poster that showed differences in the osmolarity of the tears with adequate hydration. I'm like, okay, then. So I'm open to new scientific information. And I do think it makes a difference. And think about that poor little lacrimal gland. It's like, you want me to do what with no resources? Come on here. Like, help me help you. So you got to give it liquid, fluid, hydration, excellent hydration. And you need more than you think. I practice what I preach. This is a SodaStream refillable metal bottle. And I love the carbonation as it goes down my throat. I get a neural stimulation effect, a tear effect. It's so good.
And then another main one, of course, is nutrition. So I'll let Dr. Periman take this one.
Yes, so nutrition, I'm very interested in nutrition. It's not something we're taught in medical school, so I've had to learn it on the fly in real time, in real life. I've tried a whole bunch of different things. And this is literally my own kitchen, my own food. These are some Instagram posts that I've done. I'm Dry Eye Master on Instagram. Dr. Maiti is Dr. Maiti Eyeballs and stuff on Instagram. Really fun channel she has. But this is literally stuff I do every morning. So I've got my Hydroi for my omegas. I have my curcumin for the turmeric. The highly bioavailable curcuminoids have some really interesting clinical white paper work behind them. This particular brand, curcumin, I've been helping the company with some of their clinical development, and I've been taking it for a year. I'm almost 53 and I'm running like a champ. I'm running as fast as I was 15 years ago. So that's really amazing. Nothing hurts, it's great. Helps with gut inflammation, helps with rosacea, helps with cognitive function. It just decreases the inflammatory load that comes from the gut. So that's a very really cool product to add on to your recommendations. The green smoothie or the veggie shake. I'm not a kitchen gadget girl, but I have two things that I can't live without. It's my Vitamix and my air fryer. These two things really help me dial in the nutrition piece. So every single morning, I make myself a veggie shake. And here's how I make it easy for myself. I put on Sunday nights, I line up 7 different Ziploc bags. And in each bag, I'm putting a quarter of a green apple, a stalk of celery, a quarter of a bulb of fennel, a handful of organic mixed greens, a cube of frozen wheatgrass if you can, a 1-inch piece of ginger, some fresh basil leaves or mint leaves, whatever I have that's available there, teeny bit of lemon, but if you have a rosacea patient, hold off on the citrus until your gut gets better. Zip it up, stick it in the freezer every morning. I pop out one of my little veggie bags and put in the blender and off I go. So and it's great for a busy clinic because there are times when there's not time to eat. Right, Dr. M?
Yes. So something quick, quick is important.
It happens a lot in our clinic. But yeah, I've got this to keep me going all day long. So it's a wonderful thing. When I travel, I'm grumpy. When I don't have my veggie shake, I can't wait to get back to it. When you focus on a diversity of vegetables, you really want to nuke it on high in the Vitamix. Like it's a good investment. The fibers break apart, and that's a prebiotic that gives the good bacteria something to perch onto as it transmits through the gut and helps to neutralize and normalize your gut biodiversity. Super cool. Turns out gut biodiversity is severely compromised in rosacea patients. So it's never made sense to me to give a rosacea patient with MGD doxycycline. That's an antibiotic. You're putting another layer of insult onto the underlying pathophysiologic problem. So I put a lot of my patients on the green smoothie recipe, on the Hydroi, on the curcumin as a baseline level. And then I really like making food that's healthy and delicious. And that's a typical lunch for me. That is the nutrition piece. Don't underestimate it. There is a flip side to this. Now, Americans being as they are, have this dysfunctional mindset. If some is good, more is better. And that's not always true. I've seen cases of hypervitaminosis, self-induced hypervitaminosis, to the point of toxic levels. I'll never forget this 28-year-old computer programmer, probably slightly spectrum, had this weird maculopathy, 20/30 vision, this weird maculopathy. And finally, I asked him, why don't you bring in everything that you're taking? And he had a giant box of all his supplements. I'm like, oh. Yeah. So then I tested him for all those vitamins, and they were just like toxic levels galore. So we got all that dialed in. His maculopathy got better somewhat. It wasn't fully reversible. So you have to watch out for these things. But this whole food-based nutrition, 2 thumbs up, right? You're not going to OD it on any of this stuff. This is all just good basic stuff. And you have to eat anyway. When you eat things like this, your appetite for the Big Mac is gone. So using food as pharmacy, F-A-R-M, what goes in the pie hole matters. Grandma was right. You are what you eat.
Yes. Yeah, absolutely. And We,
Laura, we had a question from Abby. Could you repeat the brand of turmeric that you had referenced?
Yes, it's in the photo in the blue bottle, Kirkwood one, and you can get it on Amazon. In disclosure, I do consult with that company.
Great.
But,
Yeah, we've got that in the
cool.
chat now. Thank you.
Yes, of course.
and we are in the works of creating another Instagram account called Dry Eye Chefs. We haven't quite got it going yet, but we will hopefully will, and that'll include, you know, some recipes and things like that that you can, you know, use yourself or suggest to patients. So hopefully, you know, coming soon.
Right, right. And then just to make it easy for the clinician, when it comes to, well, what can I eat? Because there's a lot of confusion amongst patients. It's like, I've tried the AIP, the autoimmune protocol diet, which is intense. And if you have an autoimmune disease, absolutely do that. But short of that, the biggest problem I think we face as a comorbidity with MGD is rosacea. And the best diet for that is the Whole30, WHOLE 30, the Whole30 nutrition plan. Your patient will never be hungry. It will teach them to recognize what their food frenemies are. Food that you think that you love, but don't love you back, right? And the typical triggers are, for the rosacea patient, are gluten and dairy. But tell your patient, do the Whole30 diet. Here's your Hydroi, here's your Kirkwood one. Do the Whole30, do it perfect. Don't call me, go online, do it exactly as it says, no mess ups. And then reintroduce one food at a time. It tells you how to do it, and that'll save the clinician time.
Right. And then, you know, this one I don't think we need to talk about too much. Everyone is already recommending omegas to their patients, I'm assuming.
Yeah, and not just any omega, right? Like this is a very interesting slide because I love the nutritional focus of it, but there's a huge difference in the omega levels between a farm-raised fish and a wild fish. So I think it's important to err on the side of wild fish as much as possible. The delta in cost is not that significant, but it's hard to eat enough fish to get the omegas and the composition that you get in the Hydroi. I'm a big fan of the omega-3 and GLA combination because you get this synergistic suppression of the Wicked Witch of the West and the flying monkeys, the bad inflammatory factors, and you increase Glinda the Good Witch when you give those two omega-3 with GLA together. You get a prostaglandin E1, which I call Glinda the Good Witch, and that's why that combination and that formulation is so powerful, in my humble opinion. Your dog is so cute. Look at that shorty pie.
So sleep is interesting because I think sleep is one of those things where it's a little bit of like a chicken and an egg. You know, we know that poor sleep contributes to dry eye, and we know people with dry eye also have poor sleep. And so it's sort of like, well, which one is causing the others? Or probably more realistically, with like everything with dry eye, they're probably contributing to each other. And so, you know, this is something where they've done studies that show that people with really severe dry eye have sleep quality as bad as people with sleep apnea, you know, and like osteoarthritis and things like that, much worse than even patients with other ocular conditions like glaucoma and macular degeneration and things like that. So, you know, one kind of encouraging patients to pay attention to their sleep quality. And then for those patients that already have certain sleep disorders, you know, to get them treatment for those to also potentially, you know, help with the comorbid dry eye that they're having.
Yep. And that interfaces commonly in the dry eye clinic. I mean, how many times have you seen a dry MGD patient, and it wasn't until you went to lift their lid to look up here where the lid goes all the way back, like this dachshund dog here. And you see that papillary conjunctivitis, the ptosis of the temporal lashes. That triad is classic for floppy eyelid syndrome, highly correlative with obstructive sleep apnea. I don't know how many patients I've sent for sleep studies, and the sleep doctor will say, your ophthalmologist picked this up? And I had one sleep study doctor say, well, she's batting 1,000, so I wouldn't be surprised. So it's just taking care of that whole person. Once you fix the sleep apnea, you reduce the hypoxic inflammatory drive in the eyelids. That hypoxic inflammation has very high MMP9, and this is a study out of the Blue Journal in about 2006. The tissues of floppy eyelid syndrome patients are really, really high in MMP9. That breaks down the collagen and makes the lid floppy. Then sorry, I lost my train of thought. Oh, the hypoxic injury actually damages the muscle of rheolon, which is that tiny little extension of the orbicularis muscle that contracts the terminal ductal of the meibomian gland. And so if you don't have that muscle there, you're not getting any squeeze of that tiny bit of meibum with each and every blink. So there's a multitude of effects with untreated sleep apnea. And don't let size fool you. I have seen teeny tiny 100-pound women with significant sleep apnea. So don't think it's just the overweight ex-football player. Nope, it's much more common than you realize. So don't forget to look for it. But here's a young patient of mine, college student, studying engineering. I'm like, yeah, a woman in engineering, that's awesome. But she has horrible dry eye. Her mom's is even worse because they're wired the same. And lo and behold, she's got a very inefficient lid seal. That's what you see in the white arrows, that light escaping between the lid margins is what I'm looking for. And this is a technique described by Corbin Blackie called the light leak test. And you take your humble muscle light and turn off the lights in the room, put the apex of the light right at the superior tarsus, aiming at the interpalpebral fissure, and you'll see light escaping. And this is a great example of the association with meibomian gland dropout that they described. So the more the light leak, the more meibomian gland dysfunction dropout you're going to have. And this person's only 21 years old, right? And look at the asymmetry on their meibomography. The right side has less dropout than the left, and the left side is where more light leak is. So don't forget to do this quick and easy little clinical exam. I love the eye seals goggles, the vaulted silicone eye seals from eyeeco.com. Amazing product. Just don't forget to wash it every single morning with Dr. Bronner's unscented soap. You don't want Dial or Method or Triclosan or any of those perfumey fancy hand wash things. It needs to be just a simple soap because bacteria and yeast love a warm, moist environment. So you got to clean it every single night so you don't get a biofilm.
Dr. Periman, Dr. Maiti, I've got some questions before we move on to the next topic, kind of going back to our nutrition. Mackay berry, treatment of inflammation in dry eyes. Do you see any evidence to support that?
Mackay berry, yes. Mackay berry is considered to be helpful in addressing inflammation, and there is emerging science for using it in the context of dry eye. Also, psilocybines, which are, no, not psilocybines, it's I'm blanking on the word, PTERO. I just remember the taro part. Anyway, it's one of the active phytochemicals in blueberries, and that can have a powerful anti-inflammatory effect as well. Did you know blueberries have parabens in it? Like we're told all the time, parabens are bad, parabens are bad. It's like, it's a natural thing found in nature and you eat it all the time. So putting a little teeny bit in a cosmetic to prevent it from developing mold and bad bacteria seems okay to me.
In addition to prebiotics, do you recommend probiotics? And if so, what composition and brands?
Oh, that's a great question. There is a medical grade probiotic called VSL, Victor Sam Larry, VSL. You have to ask, it's not, it's an over the counter, but it's kept in the fridge behind the desk at your pharmacy. It's a medical grade probiotic. I think it's excellent. I actually recommend the sachets because then you can titrate out how much you're putting into your green veggie shake every single morning. There was a study in the Ocular Surface Journal about 2010 describing the irritable eye syndrome, and it was defined as a triad between irritable gut, dry eyes, and irritable brain, anxiety, depression, cognitive fog, whatever, the irritable eye triad. This group took the bacterial lysate, the parts of probiotics, and demonstrated a statistically significant improvement in the self-reported standardized questionnaires of patients after 30 days in their cognitive function, their dry eye, and their gut as well. And that's using the lysate. So a sonicator that breaks apart bacteria is a $50,000 lab instrument. My Vitamix on high for a minute is a pretty cheap way to replicate that idea.
Final question on the nutrition side. For omega supplements, are there particular patients that you do not recommend taking these? For example, those taking blood thinners?
That is a great question. And I think that has been debunked at this point. That idea that persists that omegas are can create bleeding is based off of a single study from the late 80s, and it's in the cardiology literature, and those patients were getting 6 grams a day. So that myth has been perpetuated, and I don't have an issue with it.
That is all I have for now, but I will continue to monitor the chat and I'll let you know.
Ooh, speaking of sleep, so this brilliant optometrist in Canada and her brother, who's a engineer, came up with this amazing concept for eyes. This is a device. I have one here. Freaking love it. That has a cooling mode and a warming mode, and the cooling mode actually helps to stimulate the TRPM8 receptors that we talked about in our last talk. So TRPM8 is a family, or TRPs are a family of super receptors that we're starting to get pharmacologic and therapeutic approaches for. ARI has a study that's going on. Novartis has a TRPV1 antagonist program treating persistent pain after cataract surgery, LASIK, PRK. Send patients for that. It's a really important study. The TRPM8 agonist, excellent improvement in tear production via stimulating the lacrimal system. You can stimulate it on the lid, you can stimulate it on the cornea, and that's what the ARI system is. And you can stimulate it with this external device as well. You put it on, you feel the cooling impact, and you can feel the tears coming immediately. It also has a vibration mode for neural stimulation that migrates back and forth across, and it's designed to mimic a restful meditative breath, which is a cycle of 4. We call that box breathing. Hold for 4, exhale for 4. It's so restful, and it prepares your body for sleep, the sleep mode. The other thing you can do to help your patients prepare for sleep hygiene, get your feet warm. Take your hair dryer, whatever it is, put some socks on, warm your feet before you get into the bed. Sleep onset is delayed if your feet are not warm. So make sure your feet are warm. Stop your device 2 hours ideally before bed. Haha, who does that? Right, but try to stop your device at least 2 hours before bed, and then use this thing. It just helps to guide you into sleep. I also like coupling this with the Calm app. CALM is a brilliant way of encouraging sleep by calming down the brain waves. You get this this integrated thermal, vibrational, breathing cue, calming approach with this technology, and it's just going to expand the cool things that it has going for it. It's a holistic way of addressing sleep hygiene. Who dat? I don't recognize that girl. That's pre-pandemic. I've lost a fair bit of muscle.
Before the COVID-19.
Yeah. I've tried to rehab from this horrible car accident I had. And it's a struggle. It's a struggle, but I still do my best to move my body every single day. Some days, all I can get in is a set of push-ups, but it's better than nothing. Just moving your body is a pillar of wellness. Parking a little bit further away from the door where you work or the grocery store. Those count. That counts. But move your body.
Yeah. Yeah, it was interesting. I actually came across a study yesterday that was published in January this year in BMC Ophthalmology, where they actually, what they did was they had subjects do aerobic exercise for just 30 minutes. So they basically jogged for 30 minutes. And they found that right after they were done jogging, that they had an increase in Schirmer's, non-invasive tear breakup, and an increased number of complete blinks, which is like kind of amazing. You know, we're actually showing objective improvement in some of these tear film parameters, you know, after just a small amount of moderate aerobic activity.
I totally agree. And I noticed that myself. I noticed that very thing, that my eyes are just more comfortable after a little jog around the hill, whatever this is. So I totally noticed that same thing. If it's a windy day, I'll pre-treat with a little dose of Tirvaya. Awesome. And then I'll wear those Seven Eyes Sienna glasses to help protect as well. But yeah, it does improve your tear production. Mindfulness, that moment of just taking a pause from the chaos of the world, the tragedies you're seeing in the news, and just taking a moment to breathe. You don't have to be a master meditator. All you need to do is close your eyes and focus on the sensation of the air flowing right at your nasal vestibules. That's it. Just notice how it feels right there. That's all you have to do. Takes seconds. Probably the best blink break I can possibly prescribe.
All right. And then we'll look into some other environmental lifestyle factors. You know, we just did a whole talk about cosmetics, so probably won't go into too much detail about this, but you know, this is certainly something you're going to want to evaluate when you're seeing your dry eye patients. These are really inexpensive changes that people can make in terms of just simple things like, you know, paying attention to the ingredients in their products, making sure they're throwing them out on time, making sure they're removing their makeup properly, but not with really harsh cleaners. So there's a lot of, you know, kind of easy recommendations that you can make there.
Yes, yes. And there's a lot of 1/3 of over-the-counter eyelash growth serums are contaminated with prostaglandin analogs. In the drug and cosmetics world, it's called adulterated cosmetics. And how they get away with it is using, there's like 100 or more iterations of the prostaglandin backbone. It's like molecular Legos. And you can put all these different pieces on it and tails on it and fluoridated groups on it to enhance the potency and the side effect, and to change the side effect profile. Well, cosmetics companies get around it by picking ingredients that are not patented for glaucoma use, because those are cherry picked for safety and efficacy and performance. You still get all the PGA side effects, right? The lash growth, the orbital fat atrophy, the MGD, all that stuff. It's true of the entire class. But over-the-counter cosmetics companies will lace their product, adulterate their product with it, and not disclose it to the patient. Sometimes I've even seen formulas advertise themselves as prostaglandin free, and I read the ingredients, I'm like, anything with a Prost in it is a prostaglandin. Think of it's a Polish drinking chair, right? Prost. It's like anything that says that is a problem. MDN, there's this formula out of Europe, M2 Lash Beauty, something like that. I'm seeing all these young women from Europe with horrible, permanent prostaglandin associated atrophy and damage. And that's because of that particular product. And they used to claim, but they were prostaglandin free. They say, oh, we just use MDN. Yeah, that's normethylamidopropionol. So there's that word Prost again. So you got to watch out for all this stuff. I don't think there is a safe eyelash growth serum. There's lash conditioners that can help. Water-free lash conditioners are great for conditioning the lash and allowing the lash to grow to its maximum length. I think as the Tarsus medication, Lotilaner, comes available, sounds like a Norwegian drinking chair. That one, Lotilaner. Lotilaner, I can't wait for that drug to be FDA approved, because those eyelashes will grow to the more natural length as well.
Yeah, what's interesting with that M2 Butte product is I remember going onto their website, and under the ingredients, like it doesn't include the prostaglandin as one of the main ingredients. So if you just click on it, it doesn't even show up. You have to actually like look at the full list. So, you know, they're being really opaque in the information that they're sharing.
Yep.
You really have to know to dig deeper and watch out for, we need to ask our patients what they're using so that we can make proper recommendations.
Yes. And the nefariousness is very much that. So my friend here was using a safe, vegan, all those stupid, marketing tags that don't mean anything, product. And she showed me the ingredients. I'm like, this isn't a complete list. Because I've read these labels enough. I'm like, there's more to the story here. Find it. It's like, and then I got the full list. I'm like, now I understand why you're having a problem, right? There's the word Prost. Anyway, and the eyelash growth serums don't have to disclose the concentration, and that has a lot to do with toxicity as well. So be very, very careful. That's why Rodan and Fields got sued for their problems associated with Lash Boost.
Laura and Dr. M, I've got several questions on the cosmetics, not surprising, but one going back even to a topic before is PRN versus Hydroi, and why both of you prefer GLA products.
Dr. M, do you want to go first?
Yeah, I mean, I think Dr. Periman had kind of addressed that we found, with the GLA seems to be a little bit more effective. I think often at the end of the day, some patients aren't necessarily going to take what you recommend, but giving your best recommendation is always best, and having your justification for that.
I think they're both great products, honestly. When I insist with patients is you need to take something that has been clinically demonstrated to help dry eye. The product you're taking has no clinical research associated with it. So that's my real sticking point. And then there's patient preferences and things like that. But being a biochemist, I really appreciate the synergistic effect and the shunting or the promotion of that awesome anti-inflammatory prostaglandin PGE1. So the odd numbered PGEs are very anti-inflammatory. PGE1 is the number one anti-inflammatory. The even numbered PGEs are very pro-inflammatory. It's a very complicated biochemistry. But if you think of Glinda the Good Witch, you got the upshot. Flying monkeys and all that stuff. Lid hygiene. Lid hygiene matters. I remember back in the day where we were telling people to use diluted baby shampoo. Please don't do that. It's way too harsh of a surfactant load for the eyelashes, for the lid margin, for the meibomian glands. It has formaldehyde releasing preservatives, so please don't do that. Use commercially prepared ones. And we really like a combination of a mechanical approach plus a surfactant-free gel approach for our lid hygiene. So I'll have my MGD patients switch to Optase gel, tea tree oil gel, because I'll get a nice antimicrobial effect. It probably discourages the mites a little bit from their nightly procreation activities. And the mechanical part brushes away the dead bodies, which are full of bacteria. They don't have an anus, so they literally die full of bacteria. So you got to brush that stuff away, brush the eggs away as best as you can. And then the mechanical part, I'm really liking Meibo brush for the shower and new lids at night, not only for really using that vibrational energy to irritate the mites and discourage them, but also to deeply clean all the makeup. We know that Demodex live for days in mascara and lipstick. Ew, right? So you really got to get all that makeup off every single night. And that's a great way to do it. Workplace. Do you want to take this one, Dr. M?
Yeah, I mean, I think this is when probably most eye doctors are already recommending. We know that during the pandemic, with people working from home and on their computer for hours and hours, there's been an increase in symptoms. So of course, I think most of us are already recommending things like the 20-20-20 rule, taking breaks, making sure that your monitors and things like that are set, at least 25 inches away, and, at a slightly downward angle rather than at an upward angle. So just taking a look at all of those things, making sure you're not set up like under a vent that's blowing on your face. Especially, now that patients are spending so much time in the same spot, doing the same thing for hours and hours. These things are really important for them to make sure that they are, paying attention to.
Yep. A little desktop humidifier can do wonders to humidify your media environment. A slight down gaze on your computer monitor can lower your lid position and lower the surface area of evaporation on your tears, and that adds up all day long. I wish he wasn't touching his eyes with his fingers. That's
yeah, don't do that.
And that little espresso he's got there, that's great, but I want to see a great big water sitting right next to it, right? What else do I want to say about this? Yeah, ergonomics are important. Cervical neck strain, you can get neural C1, C2 referred pain to the eye and vice versa with some of those musculoskeletal issues. So in some of my physical therapy after that car accident, I had this awesome PT who gave me this pearl, and it's fabulous. You know that place on top of your head where your hair grows in a swirl? That's how you come into the world, right? Point that to the heavens. It's not this, it's not that. It's a almost a puppet lifting effect. It automatically corrects all 5 curves of your spine. Your shoulders go into a natural relaxed position, improves neural flow throughout your body. So just that simple little tip, lift from the crown of your head straight up to the sky. And that helps to correct your neural flow throughout your body.
Yeah.
I'm not sure why that's on there.
Right. Just don't let hot air blow at your eyes.
Here's some more hot air, smoking
Right.
and vaping, right? This is very interesting. So smoking and vaping are highly associated with MGD. We presented some work at Ascaris in 2019, demonstrating that MMP9 increases correlated with periods of very poor air quality index in the Pacific Northwest associated with forest fires. So there's other literature showing that pollutants, an increase in gaseous emissions from cars and things are associated with increased complaints of conjunctival redness, injection, visits to the eye clinic. So that's all been established. But we were the first ones to show that the inflammatory marker actually also responds in the context of poor air quality or air pollution. We had days where our air quality index was as bad as the worst days in Beijing, China, during those 2 years of forest fires.
Yeah, and I think one thing too about this topic is, the good thing is that rates of tobacco smoking have been decreasing, over the last few decades. But what has on the opposite side been increasing is cannabis use. We practice in Seattle. Cannabis has been legal in Washington for almost a decade. And so we have a high number of patients that, they may not be smoking tobacco, but they may be smoking or vaping cannabis. And so we need to make sure we are asking patients about this, particularly because I think a lot of patients think that vaping is the safer option, both for lung stuff or whatever. But there have been studies that show that, things like aldehydes that are emitted in vape pens, as well as, other additives that may affect TRPV receptors. Vaping, we're still kind of gathering information about it, but it seems very likely that it could also be contributing to some ocular surface issues. So that may not necessarily be a better option for those patients.
You try edibles instead.
That's what I say. It's like you may want to offer
edibles. And I'm so glad you brought up that aldehyde issue. So anything with an aldehyde group on it has the potential to really irritate the corneal nerves. So it's no big surprise that if you walk into a big cloud of this stuff at a Jimmy Buffett concert, your eyes start watering and they get red, right? So it's very much a thing. We ask about it on our dry eye new patient intake forms. Do you use tobacco or vaping products? Just non-judgmentally asking, but it does make a difference in the MGD patient. When they're able to give it up, then everything else that we're doing for them works even better because they're eliminating that constant insult.
And alcohol as well, the other thing to consider is the fact that use of alcohol and cannabis have skyrocketed during the pandemic. I had looked at a study that said alcohol consumption has gone up like 67% in the last year. It makes sense. We're all kind of
nothing else to
stressed
do.
out. People are drinking a lot. But studies have also shown that there was kind of a funny study I read from last year where it was a Japanese study where they had people take 4 shots of vodka and then test some of their tear film parameters 12 hours later. And it showed decreased Schirmers, increased tear evaporation and blink rate. And so we know that alcohol is having this drying effect as well. And, there's expression of pro-inflammatory cytokines, in the corneal epithelium and things like that. So we do also want to encourage our patients to consider cutting down on their alcohol if possible.
And think of the money you'll save. I wonder if we could replicate that study in Napa, Dr. Maiti, with really good wine.
I know. I was like, how do I get into this study?
But yeah, this is a very practical way of your patient to helping their own dry eye. And I'll let you take this last one.
Yeah. So, another aspect of trying to provide better access to care is really tough because obviously, we need to get paid for the treatments and exams that we're doing. So one thing that we have really started to do in our clinic is to offer clinical trials as a way to improve access to care to patients that can't afford it otherwise, and also to offer them treatments that aren't available yet. And this is a really great way to not just, improve your own scientific interest, but to offer these treatments. You can also, if you're into this kind of thing, start to design your own investigator initiated trials to focus on certain treatments you want to offer that you want to learn more about. And a kind of side benefit to patients is not only do they not have to pay, but a lot of the studies will actually pay them to participate.
Yes. And then as far as the medications go, and I have to tip my hat to our friends in the pharmaceutical industry. I know that a lot of people, I think, misappropriate blame of the challenges in our medical system. I don't think it's with them. We need innovations for our patients, and most of them will have a compassionate use program and a patient assistance program for people who are in the poverty level. And it's a very generous program. I know across the board, and many of the sponsors that are here supporting this amazing event will offer patient assistance with their pharmaceuticals. Dompay, Allergan, Novartis, Oyster Point, like all these people will help if there really is a dire financial situation. But on the other hand, if you show up with a fancy iPhone and a Starbucks and a Louis Vuitton bag, right? Let's talk about priorities for just a second. Oh, and a bagel. No, don't do that. Like, let's just revamp all this.
Yes, but yeah, there definitely are resources out there, so, know that you can work with the companies to find out about these things that can help your patients access, the treatments that will benefit them.
Mm. Great. Here's our humble
we've got quite a few questions here.
All right, let's do
5
it.
minutes here.
Yeah.
We're just going to go rapid fire.
Okay.
Great stuff here. I took some notes. The overweight ex-football player in the room learned a little bit here. Looking at things, recommended brands of EyeFriendly Cosmetics.
I don't recommend any brands.
Lash extensions, yay or nay?
How about it? Can a HE double hockey stick? No.
Yeah. Just a hard no on that.
Hard no.
Permanent
Hard
eyelid
no.
tattoos. Permanent eyelid tattoos, yay or nay?
Nay.
Nay.
What are some safe and gentle ways to remove makeup? Many of my patients have been recommended baby shampoo from other optometrists, and they're finding that the lid wipes are a little bit too rough and harsh.
Yes, so the lid wipe, I agree, there's a big difference in the cloth in the prepackaged wipes, I really, really like the Optase Tea Tree Oil wipe. The cloth is much softer and it's larger, so you can actually start with the eyes, get your lids, lashes clean, get some of that makeup off, and then use it for the rest of the face. So I really, really like that. I like new lids a lot, especially with Zaki Shield as a final makeup removal. That mechanical stimulation really gets in between all the little lash bases and gets rid of all that mascara that the Demodex thrive upon. So I like that mechanical approach and that surfactant-free approach. And I agree with you. Some of the cloths are too toothy. They're too rough.
Micellar water wipes.
Depends. What brand are we talking about? If we're talking about Neutrogena, they're full of formaldehyde donating preservatives. If you're talking about Trader Joe's micellar wipe, if you're talking about Simple, you can get that one on Amazon. Those are good products for removing makeup. I like to pre-remove my makeup with a water-free system, either We Love Eyes oil or argan oil, or there's a product, there's a balm from Sephora called Pharmacy Clean Greens, F-A-R-M, Pharmacy Clean Greens. It's this awesome balm for removing the makeup, and then I follow it with a Trader Joe's micellar makeup remover wipe, and then I follow it with the new lids and Zaki Shield at night, and then I have a magnified light mirror, and I can see that I've gotten it off.
Which is safer, Latisse or Lash Boost?
That's a no-brainer. Latisse has actually been studied, right? And they're trying, well, okay, so it turns out isopropyl chlorprostonate is far more potent than bromatoprost. And the Lash Boost does not tell you the concentration that's in their formula. I'll leave it at that. I can't say anymore.
I think we got through all the questions here. So any final comments as we wrap up Eyes on Dry Eye implementation track for the docs, our esteemed panelists?
Follow us on Instagram. I'm Dry Eye Master, and Dr. Maiti is Dr. Maiti's eyeballs and stuff.
Yeah, and feel free to send us questions. We always love to talk to other eye doctors about this stuff.
And we're learning. We're still learning. There's so much to learn. When we were preparing our CE talk, we realized we've got about 6 hours of content here. How are we going to pare it down?
That has been the common theme. Is there's so much out there, right? And that's why we need events like what we're trying to do. So I appreciate your contribution, both on the clinical track, implementation track, Dr. Periman, Dr. Maiti. I hope that you can join us now in the exhibit hall. Jackie, Ahmad, and I are going to huddle up with the Eyes On team. We're going to have some final comments, have a little celebration. Again, thank you for joining me all weekend on the implementation track. Laura, Sathi, that was fantastic.
Thank you.
Thank you. Yeah, it was a great event.